So often I hear from our businesses who share with me that the safest place they think folks are at the place of business because they have these protocols for us to stay open and keep growing while so many are hurting. It's so important that we're doing everything that we can to help them, to assist them, so that they can stay open.
Governor HOLCOMB saying Indiana will remain open. The Hoosier State is now back on track stage 5 and seeing continued jumps in the number of daily COVID-19 cases. Good evening. We're glad you're with us tonight. I'm Linda Jackson.
And I'm Tom Powell. What next steps should our lawmakers take to make sure Hoosiers are safe? That depends on who you ask. Before we hear from state officials and candidates for state office, we want to share the latest state and local data with you. Let's look together now. Health officials say 72 more people tested positive for the disease, bringing the countywide total to just under 6,800. They reported no new deaths, so the death toll stands tonight at 207. Across Indiana, the number of new confirmed cases topped 1,300. To date, more than 128,000 Hoosiers have tested positive for the virus. 17 more Hoosiers have died. That brings the state death toll to 3,500 exactly since the pandemic began.
As more Hoosiers are diagnosed with COVID-19 and admitted to hospitals, the Democratic candidate for governor insists that Indiana is not doing enough to protect Hoosiers. Fort Wayne's NBC reporter Corinne Rose brings us the latest from the candidate, Dr. Woody Myers, and the state's health commissioner who defends Indiana's COVID containment tactics.
The hospital admissions in recent days are now as high as those seen in late May. This is all further evidence that moving us to stage 5 was wrong.
Dr. Woody Myers is the Democrat running to unseat Governor HOLCOMB. As a physician and former state health commissioner, he's concerned the severe COVID-19 outbreak in southwest Indiana and continuing new cases elsewhere are making the state look bad. The city of Chicago is strongly advising residents not to travel here.
It's a big red flashing sign that says that there is a difference between what Illinois and Chicago are seeing going on in Indiana and what we believe to be the one going on in Indiana, and that Chicago is worried about us, Illinois is worried about us because they see our numbers going in the wrong direction and they want to protect themselves.
We have times when we have more hotspots and other states have times like Illinois where they have more hotspots. So what we continue to focus on here as the state of Indiana is what we know works, and that is the ability to make sure that we are wearing masks, that we are social distancing, that we are doing the best hand hygiene.
Dr. Box agrees that Indiana's numbers continue to rise and says while non-COVID patients are taking up most of the state's ventilators and ICU beds, she's watching those numbers closely. And she says the state's COVID mapping is helping pinpoint problem areas.
We can localize those areas where we know we are having more cases, where we know we are having more hospitalizations, and to work individually with those particular counties or districts to make sure that we address with them those options available to them.
Dr. Myers believes local health departments don't need options, they need better guidelines from the CDC and the state. Both doctors agree that an expected difficult flu season with unchecked COVID cases will strain Indiana's hospitals this fall. Corinne Rose, Fort Wayne's NBC.
Now, we reached out to officials with Governor HOLCOMB's re-election campaign for their response to Myers' accusations, and they tell us that, quote, Woody is trying to scare Hoosiers. A statement reads in part, and I quote again, "We've made so much progress compared to other states. Together, we've made it to stage 5 because of Hoosiers' actions, and it's those same actions that will keep Hoosiers safe and our economy open," end quote. Tom?